Hey, this is Stephen Klein with Healthy Fit Club on location in Costa Rica. So this is one of my favorite, probably my favorite interview to date for several reasons. One, Dr. Ignacio Vargas just finished getting 7 teeth, making them mercury free, taking four fillings, and replacing 3 crowns. Complicated process, so I'm very, very excited because it's all over for me and I've got no more mercury in my mouth. And that's the reason for this video. I came to Costa Rica. The name of this practice is America BioDental. I had been on a search to get this work done for quite a while. And a lot of people think, oh, well, the reason why someone would go to Costa Rica is because it's a lot less expensive. And that's true. But in the dental industry, it's kind of kept under the carpet that removing mercury probably isn't the safest thing if you don't follow certain protocols. So we're going to have a dialogue about that, and I'm really excited again because I'm now mercury free, but I want to share with all of you what your options are out there instead of just going down to your local dentist or who you've used that may not follow safe protocols. Am I telling you you need to do that? Absolutely not. I just want to make sure you're aware of what your options are and what some of the dangers might be. All right? So Dr. Ignacio Vargas, you gave up your acting career in Hollywood to become a dentist. so tell me a little bit about yourself. How long have you been with this practice?
We have 12 years working with patients and like 8 years trying to work with more holistic and biological dentists.
Okay, so holistic and biological dentistry, that's what we're going to talk about. And I first kind of was introduced to this through Nadine Artemis, who's really famous in the United States for holistic dentistry, and I heard her on a Bulletproof podcast with Dave Asprey, and I started looking into for myself how I could solve this issue. So we're here in Escazú, Costa Rica, beautiful facility. You're opening another one right down the way next to the SEMA International Hospital, right? And you specialize in holistic dentistry, so you did some things with me that I felt not only really safe, but it seemed like you went really above and beyond to follow safe protocols to remove mercury. Now, I didn't know this, but in some of the reading that I've done from Bob Marshall, who's also a leader in holistic dentistry, that like more than 50% of a silver filling is made of mercury.
Yes.
And that when they test mercury vapors in the average person's mouth, it's something like 80 times what's allowed by the US government. So you figure if you've got mercury vapor swimming around, and anything you do on a day-to-day basis is going to, that's going to be out there. And so it was a concern to me. I figured it would be a concern to most of you all. So let's talk about what you do in this clinic to safely and effectively remove mercury fillings without that mercury leaching into the rest of the body. Now, some dentists don't think that's a problem at all. They say, hey, come down to my office, I'll remove your mercury. No problem, we do that all the time. You have that choice. But I'd love for everybody to hear what you offer in this practice, because I'm sure it's going to sound attractive to everybody to know they're going to be safeguarded and there'll be no worries or dangers, or they're drastically minimized, and the price point isn't going to hurt either, because I was really excited when I saw what my bill was here versus what I was going to pay in the States. So, Dr. Vargas, walk us through kind of the procedure, like just with me, because you're going to see some pictures that we took of me in the procedure, in the chair, and we'll talk about the equipment also. So starting from the beginning, new patient comes in, you've already got the x-rays usually that they've sent from their dentist or whatever. You've identified what the issue is and what you're going to do. So you can use mine for example if you'd like, but what are the first steps that you take, and what do you do to begin the process? Explain to the patient so they feel comfortable with the process, and then move through it. So
sure. So the process starts when we test to start to see how many fillings has the patient. We test and we see what is the most bigger. Sometimes when we test, the smaller could be the worst, and depends on the surface, because the surface means that if you bite and if you drink something cold or not something hot, you can have more vapors. So everything depends of that test. So we start to do tests. We see how many fillings has a patient, and then we prepare the next day. It could be the afternoon started protocol. the protocol will start very different than the protocol that we have, because we have to check every step from the protocol that started for the Novocaine that we was talking about, for the needle, from the filling, the bonding system. So every time we are improving on bonding system, on materials, and to the end we have a nice protocol, very strong and very protective for the patient. Something very important is that the dentist trusts in the work that we are doing. If I don't trust in the mercury, we saw some pictures that the dentist doesn't have a mask. So I think the dentist is doing that because they want to not help the patient. They want to do the treatment only with a rubber dam to make money, or I don't know what. But we trust in the process, and we saw and we test the mercury vapors on the room, and we look like it's very dangerous for all the team and for the patient. So that's why we start to change the process and to stage the protocol. We want to move from this office to other office for the same reason. We don't want to be all day with mercury.
So that office is going to be exclusively removing mercury.
Yes,
That's
sir.
all the other stuff that you do here for cosmetic dentistry, or what do you call it when you're basically just doing
Implants or
Yeah.
other type of treatments. It's not fair for a patient that is staying in the office and is going to do
Sure.
like a crown or implant,
And they have to breathe.
they have to breathe that. And for my health, for my family, for all the team, it's not good. So we want to do that protocol in other office that we remove and we go out.
Right.
We leave the clinic cleaning
Clear,
the
sure.
air.
So I'll review kind of what I remember, and then I'd like for you to get more specific with it, and then I'll kind of rehash what you say just so people are clear. And the one thing that you mentioned, with even a small filling could be more dangerous than a bigger one,
Sure.
because if the surface of that filling, when you bite, depending on how that comes together, could release more mercury vapors
Yes.
than a bigger filling could.
Yes.
And if you, like you said, eat ice or cold stuff or hot stuff or coffee, that could have a tendency to release more of the mercury vapor
Yes.
than a bigger filling where there's an even bite, right? So what I remember, and this is kind of interesting when I came in, because this was, I read all about on the website, what you all do in the protocols, and I was excited to come here and felt confident, and I trusted you guys. So and it just got better and better when I came in, because after the consultation, so I came in. First, we did 3 fillings that I had, and to get me set up, you did use Novocaine to numb me. You said that there's a particular type you use that's going to dissipate faster. It's going to allow for doesn't go into the blood.
The blood,
Right.
yeah, it's not going to make any change on the blood.
Right. So then you put the rubber dam in, and you tested with water to make sure nothing went through,
Yes.
which I thought was amazing. It's like, okay, who does that? So then you vacuumed that out. Then you covered my entire body except for the hole where the dam was.
Yes.
Everything. You put a nose clip of oxygen on before that, so that I was breathing pure oxygen, right?
And then another mask.
And then another mask on top of that. And then glasses, the shield, and then you had somebody with a vacuum there also, right? To vacuum the vapors.
Yes, sir.
So I was like, wow, that's pretty impressive. And then you guys wear gas masks also. So,
Yes.
so that brings up a point. I don't know if this is true, but most of you have heard that dentists have a very high mortality rate, like they die at a really young age, and very high suicide rates. And a lot of that, I'm not saying that it is, but it could be from exposure to mercury, which causes depression and some other side effects. In a lot of ways, they call it a slow death because it doesn't act on you immediately. There's a lot of symptoms that play out over time.
Sure.
So obviously you're protecting yourself, and your staff is, with gas masks,
Yeah.
which could scare some patients when they see that and go, oh my God. But you make sure to protect the patient as much as possible also. That really impressed me. And then the next thing, so when you were done with the fillings, before you refilled them, you removed the mercury fillings first, and then we went into another room. Explain to us why we left this room, let's say, and went into the other exam room. Why did we do that?
A lot of people, like 90% of the dentists, they remove the mercury and they stay doing the filling.
Sure.
Sometimes it take 1 hour to do a big filling, and that hour we tested and we looked at the environment has mercury, so you could they can remove your mercury very fast, but you're going to be 1 hour with that mercury vapors in the air. So we have to move, we have to go outside. You're going to be numb, so we don't need to put more Novocaine or numb the area again, and then we wait until the room is, and we go to other room to make the filling.
Right.
And it's because of that, it's because we test and we are making tests and we are improving the protocol. And it's true, if I test and I don't see any mercury, I don't put a mask.
Right.
But I test and I have to put a mask instead.
Right. So these guys test for mercury levels in the room, but what's amazing is, so he removes my fillings, I've got the Novocaine, I go out, I wait a little bit, I go back into another room for him to fill the mercury, and while he's doing that, he has an ozone air cleansing system in this room, cleaning this room of the mercury vapors so it can be used again, in a short amount of time, but not immediately exposing the patient to risk of mercury vapors that have just been removed floating around the air. So then when we're going to replace the mercury fillings with the safe version, I didn't even ask you about that, can you explain what you used to fill or replace the mercury so that the patient's safe, it's going to last a long time, it's biocompatible?
Sure.
Some of this.
Sure. Every step is very important. So every step we have to use the best, the best biocompatible material, because you can be on the biological dentist and they do the filling and they put like a resin composite from 3M, and that composite has BISMA. That is a material that a lot of people, when they bring the test, they are not biocompatible. So 98% of the people are biocompatible with the Dynolite.
Dynolite.
Yes, okay. It has all the materials inside the filling material that has inside the composite is the best. It's very strong. We have that to make crowns. That material can make crowns, and very strong crown, and zirconium. When it's very big, we have to. Normally the fillings are not small. All the time are big. So in cases that are big, we make a scan of the mouth, and we start to do inlays right away. We can make the inlay 1 hour and cement it to the patient, and they're going to have the best filling. Right. I did an inlay for myself because I have big filling, big inlay, and it's safe. So
right. So I want to talk about that a little bit. So about 6 months ago, I'd been in touch with Victor, and we'll take a picture of the marketing director, Victor, great guy. And we were talking about, and then Dr. K, Adias, about what was going to be expected of me. I'd sent my x-rays ahead, and they were like, well, you're going to need maybe 5 business days because we have to do a temporary crown and then fit it. And I came down here. Now you have this amazing new technology that you just mentioned that we're going to have edited into this video so people can see it. But this machine, literally, before the machine goes to work, you have a tool that will scan the tube. It will show that image on the computer part of the machine that shows you a 3D image that you can turn around or whatever. But it creates an exact image of the inlay or whatever it is of the crown, and then the machine literally cuts it out, almost like 3D imaging, from a block of cubic zirconium, zirconium or whatever it is you're going to use, and boom, an hour later or whatever you said, it's ready. So there's no more, and that's a big deal when you're using medical tourism, especially because if you come down and you get your temp and then you have what should be a good fit put in later, and you're supposed to leave the next day, if it doesn't fit right, you're screwed, right? Yeah. So this makes an exact fit, you don't have to worry about it, and I was blown away because my stay here shortened a little bit, but that allows me to do other things.
And sometimes sometimes it's a problem when we send to the lab, and the lab brings and has a small gap between your tooth and the crown.
Right.
That we don't want to have any gap. We have to be the crown or the inlay fit well. So if we have a gap, we have to send to the lab, or we have to take impression, put Novocaine. Right. If we have any problem with that crown, we scan again, and we do the crown in 1 hour.
Yeah.
So the dentistry that we are doing, we have to improve the more fat. We have to do it fast. Some patients, they want to come the weekend. So we're going to start in the future opening the weekends because the patient wants to come on Friday, leave on Monday because they have to work, and we have that machine to start to help people like that. So
yeah, just even my own experience was incredible because I had 4 fillings, one you had to do an inlay with, and then I had 3 existing crowns. Well, I never would have considered replacing those crowns with the old technology you had. I would have been here for a lot longer than I would have really had time to stay with work and all my other obligations. So we did the 4 existing fillings we planned to do, but then we replaced 3 crowns that I had, and tell them why maybe it's a good idea to consider replacing existing crowns. Why would I even think about doing that if I already had 3 crowns? Why would I change it?
It's a problem when you don't go to a biological dentist and they do, like conventional dentists, they do the crown, and sometimes they don't remove the mercury around. So you have a big filling with mercury, they drill, they make the crown on top, and then you go home. You don't know what is inside. So sometimes we have to cut crowns. When the patient wants to be free of mercury, we have to cut crowns. We don't trust in nobody. We can see through the x-ray to see if you have mercury. So we have to cut the crown, like a big percent, they have the mercury filling right there. Then we start the process to remove and make a new crown. So in your case, you are 100% mercury because we remove crowns.
And even if there's no mercury behind it or underneath the crown, in a lot of cases the crowns that are existing are metal or made of a material that they're not biocompatible.
Exactly.
So it's not the best case scenario. So it's like, hey,
sometimes it's gold, sometimes it's metal porcelain crown. Yeah. Sometimes it's a type of porcelain that is not biocompatible, or the patient has a cement that is not biocompatible. So it's very difficult because we have to be perfect in every step. One step, if we fail, we can make you a beautiful crown of zirconia. If we fail on the cement, you're going to be in trouble.
Right. So the other thing that's exciting to me is I'm kind of a wuss when it comes to dentistry, and I've never been excited to go to the dentist. Like I've never been, hey, I'm going to the dentist. Right? But my experience here was completely pain-free. I had no issues. I was amazed that even when I came back in, so today, this was the chair, right behind me is the exam chair where we finished the fittings of my 3 crowns and then polished. And when Rebecca went to put in took out the temporaries and put in the permanents, she didn't even have to use Novocaine.
The protocol that we are using to cement crowns is the best in this moment. We don't know how it's going to be in 2 years, 3 years. So we have to start to study every year, continue study to see what is the best bonding system, and because everything changed. The crowns that I placed 2 years ago changed.
So what did you use to bond? Well, you didn't bond these crowns, but had you been here, Rebecca did it. But she used a tool to bond the crowns. That's a laser or something? What was that?
Yes, that's a light to put the cement more hard. Is to get harder the cement. So we use that to do it more fast, but because you didn't felt any sensitive is because we put a bonding system that we're using. Sometimes when we remove the temporary, you feel a lot of pain, sensitive pain.
Right.
But because of the bonding that we use, the patient doesn't feel sensitive. That's a big improvement, and is every year is changing for that. So that's why we have to continue study and be aware. In Costa Rica, we have a good connection with the United States to go and learn more, and internet videos and Facebook. I am in different groups of very important dentists in the world. So all the dentists put cases, and we're every day learning more. So
it's fantastic. So these guys are constantly improving, looking to increase your safety, minimize the risk, new technologies all the time. So it's fantastic. Plus, it's in Costa Rica. So it's a pretty cool area to visit. Not only that, when you compare the price points here with what you would have in the United States to get the same work done, which keep in mind you'd have to probably leave your area to go find someone that's even remotely close to using these kinds of protocols. Sure. And they exist. If you look for them in the United States, they're there, but usually not right around the corner. So guess what? you're going to have to spend money traveling anyway, and those dentists charge way more than conventional dentists do anyway.
Sure.
So to be able to come down here and get the discount on what a conventional dentist would charge, enjoy some time in Costa Rica, and get it all done. I mean, I was amazed that all 7 teeth, mercury-free, 7. And I got here on Tuesday, we did the consult. Wednesday we had treatment, Thursday I was off, and today we finished. 2 days.
Sure.
Took care of everything.
Sure.
So that amazes me. What else would you like to share, Dr. Vargas, about what you all do here, what excites you, what you have planned for the clinic?
Sure. We're going to improve and make bigger and more operatories, more people working, because we have patients from all around the world. We have patients from Europe that I sometimes say, why you come for 2 fillings? You cannot do it. You travel 8 hours or 10 hours to come here. They say, I prefer to do it safe. So if I am in that position to find the things that I know right now about mercury, I will fly to Australia to remove mercury if it's safe.
Yeah.
So that's why people are coming every day to the clinic because the protocol is huge, and we don't need to add anything.
Yeah.
Only if a new material comes, we add that, but we are going to improve the protocol to be the best. Try to do the best for the patients.
I'm impressed. So to tell you a little bit about Escazú is like roughly 30 minutes from San Jose, or 20 minutes. It's a really, really nice suburb there, fairly affluent.
This is the place that more safe, very wealthy people live here. This is a very safe. Avenida Escazú is the place, the mall that we are here, and it's very safe. You can see a lot of police people.
Yeah, and on the segways too.
Yeah.
They've got their guns and they're on segway, bikes, and everything.
And Costa Rica is very safe.
Yeah.
If you walk, you can go to different houses that we have, Airbnbs or hotels. You can go walking, and it's very safe.
Yeah.
Yeah.
And you guys are affiliated with Airbnbs that'll take care of you at a really cost-effective rate if somebody wants to stay there. And then you have hotels like the Four Seasons here, or the Intercontinental.
Yes.
Right. So there's really nice accommodations, wide spectrum of that. But you're in a really great part of Costa Rica. So
Sure.
come get your teeth done and then go travel, have
Sure.
fun, whatever you want to do.
Exactly.
So anything else you'd like to add? Oh, doctor, tell us a little bit about, so you handle like the mercury removal is your specialty, but they do all kind of other reconstructive dentistry here,
Sure.
right? So that's Dr. Orozco takes care of that, that's not where you as well.
We're doing, Dr. Orozco helps with all the protocols and with all the systems. We have maxillofacial doctor to do surgery treatments, orthodontic doctors. We don't like to use a lot of endodontic doctors,
Right.
because we don't like to make root canals. So we are trying to avoid with the materials, avoid root canals.
Right.
Sometimes the patient brings like the dental plan from the dentist, and in the dental plan you can see root canal, post, and Corbeil crown. And when they come, it's a big cavity, and we put biodentin, same filling, new filling, and they can go. Save money and save a treatment that can be worse, because
Right.
people come to remove the root canal sometimes.
Mhm.
So the problem with the dentistry is the dentist. It's not that the patient doesn't clean well. The problem is the dentist, because you have a big cavity and they're going to do a root canal right away.
Right.
If you feel sensitive, go to the root canal, and you say, okay, let's go root canal, crown, and then you start with the problems. So I think the problem is the dentist.
So you guys avoid the root canal.
We
on
try
that.
to.
Yeah. Okay. Nice. So you guys pretty much do everything, and you try to stay away from the endodontic work, but you cover everything. So it's an impressive facility. You work extremely hard. You care for the patients. I was amazed when we got to a certain point. You're like, hey, you want to knock out those 3 crowns tonight? Look at my watch, it says now. So I was like, okay, let's do it now. So we took care of all the teeth pretty much, at least cutting the crowns. We only have one more day to finish everything, so it was really impressive. I had a great experience. Your marketing guy, Victor, is phenomenal. We had a chance to meet and talk about what his plans are, what you guys are doing to get into the market and make more people aware of what you guys do here. Impressed with that. The whole thing, that the people work up front to take care of you. And the Airbnbs also. So I was staying with one of the Airbnbs 4 blocks away. Just walked to the clinic, walk back. So so I urge all of you to take into consideration. Again, I'm not saying, hey, you're going to die if you get your mercury fillings removed from your local dentist. All I'm saying is that, we all filter. Just about everybody that's watching this drinks filtered water or even bottled water, which we're making known kind of the dangers of that as well. But why would you filter water if you have some chlorine in it? Why do you do that? To remove the chlorine, so you don't get chlorine in your body, right? Why in the world would you go pop mercury and expose yourself to one of the most toxic things you're going to come across in your entire life without looking at what your options are? So you can go do that or look at a way to remove it safely here at CostaRicanBioDental.com and have a good vacation. So anything else you want to share with everybody? Or?
I want to share about the process of if you are sick and you're looking to be healthy, I think you have to start with the dentist. Go to your dentist, remove mercury, and then continue with other problems that you have. But if you start with try to eat better or do some changes with the different parts of your body, and you have mercury, that you are going to spend a lot of money doing treatments. At the end, you're not going to go to the goal that you want to be healthy. Right. So start with the dentist. The problems start in the mouth all the time.
That's a great.
Clean mercury, root canals, and then go to your doctor or somebody who is helping you, and you're going to see the improvement. I believe in this because we're looking changes with the patient. The patient send emails or videos about improvement because we remove 1 or 2 or 3 or 10, and we're believing in that because of that. If I don't see any change on the patient, I will not do this.
Yeah. So I know that from some of the reading that I've done that the mercury, when I said earlier, it's kind of a slow death. It causes all kind of ailments in people that they diagnose as certain things, but the cause is the mercury in the mouth, and so they'll get candida, and they'll go try to do a candida cleanse or get rid of candida, and that's flourishing because of the mercury, and it bonds to that. A lot of different things, but all kind of like you said, all kind of things that people could suffer from, and it starts here. So that's a huge point that I overlooked. So get your mercury fillings removed safely. Then you'll find other things that you're having issues with you can get rid of a lot easier because the source of that problem is gone and eliminated.
Sure. I noticed something important in Costa Rica, that if you go to a hospital in Costa Rica and you need like a heart surgery or any surgery in your body, you have to go to the dentist. In this, you go to the dentist first, remove infections and other problems, and then you go to surgery.
Wow. And
so I asked him, I said, how work? They work in the heart. They don't care about if you had infection in your mouth. Right. So if in Costa Rica is doing that, it's because and the doctors are doing that. They send it first to the dentist. Why you don't go to the dentist and you spend 10 years? People spend 20 years trying to be healthy, and they come here with 80 years old and they have a lot of mercury, and so now remove it.
Yeah, all that, and people don't think about that. Plus in the United States, we're just getting to the point where doctors are seeing the body as a whole. Sure. Where if you were an ENT doctor, you treat just the ear, nose, or throat, and that's it. Nothing else matters. When you're a cardiologist, you treat the heart. Nothing else. Now they're finally starting to the point where they see that all that stuff's connected, which should seem obvious.
Sure.
But common sense isn't too common, right? So you guys are ahead of the curve. I didn't know that you guys did that.
Yes, we're doing that.
So that's good stuff. So anything else you want to add? We good. This has been a great conversation. It's been a great experience for me. I'm so excited that I am mercury-free because I've been looking to do this for like 2 years. And so the limitations are, look at the dentist were my choices in the United States were cost, time, all these things that came into play. I came down here, I'm here 4 days, it's gone. The price point is incredible, the value, and this is definitely something that I'm going to share with as many people as I can, especially people that come to see this information on Healthy Fit Club. This is great content. This is my favorite interview that I've done. Thank you for taking care of me.
Thanks
safe.
so much. Thank you for coming.